Dr. Hennis, is it okay if we start?
But of course, Dr. Renato.
Recording in progress.
Hello, everyone. Thank you for joining us for today's event, which will start shortly. I'd like to remind you that simultaneous translation is available in English and Spanish. To activate this translation, click on the globe icon on the bottom of your screen and choose your preferred language. Thank you again for participating, and the session will begin shortly. Hola a todos. Gracias por acompañarnos en el evento de hoy.
He's repeating the explanation of the translation.
Para activar esta traducción, hagan clic en el globo que está en la parte inferior de su pantalla y elijan el idioma que prefieran. Gracias de nuevo por su participación y la sesión comenzará en breve. Good morning and welcome to the launch of the Pan American Health Organization's High-Level Commission on Mental Health and COVID-19. My name is Renato Oliveira. I'm the Chief of the Mental Health and Substance Use Unit at PAHO, and it's an honor for me to be here to moderate today's virtual event. This commission represents a significant collaborative effort by many, and we are eager to share it with the region so that everyone can follow along and participate in its work. Without further ado, I'd like to present the director of the Pan American Health Organization, Dr. Carissa Etienne, to deliver the opening remarks. Dr. Etienne, you have the floor.
Thank you very much, and good morning and a warm welcome to all who are joining us today. It is really my great pleasure to welcome you to the launch of the PAHO High-Level Commission on Mental Health and COVID-19. Let me extend a special thank you to Vice Minister Epsi Campbell-Barr, Vice President of Costa Rica, and to Ambassador Nestor Mendez, the Assistant Secretary General of the Organization of American States, who have graciously agreed to serve as co-chairs of the Commission. And a warm welcome also to our esteemed commissioners. Permit me also to recognize the Honorable Leader Mercedes Sosa, the Vice Minister of Governance and Health Surveillance of Paraguay, and the Honorable Terrence Singh, Minister of Health of Trinidad and Tobago. As you well know, we are now entering the third year since the onset of the COVID-19 pandemic in 2020, and we are still confronting the ongoing impact of this public health emergency. The social, economic, and health impact of the pandemic is enormous, particularly affecting people living in conditions of vulnerability. Less visible, but no less devastating, is the impact that the pandemic continues to have on mental health. Physical distancing measures, unemployment, financial insecurity, the loss of loved ones, misinformation, and the never-ending cycle of bad news are only some of the many circumstances that have contributed to widespread stress, anxiety, and depression across the region. Healthcare workers, frontline workers, people with pre-existing mental health conditions, young people, single mothers, minority groups, and migrants, among others, are bearing a disproportionate burden of this suffering. Children and adolescents in particular face unparalleled threats to their mental health, which will likely shape their well-being over the course of their lives. Despite some efforts to respond to rising mental health needs during the pandemic, countries are struggling to meet such demands. Sustained disruptions to essential mental health services remain a significant obstacle, and these services have been among the most severely impacted by the pandemic. This situation is a result of the long-standing low prioritization and investment that were afforded to mental health services in the region. But to these challenges, we now need to add the growing awareness of the long-term mental and neurological consequences of COVID-19. In light of the current mental health crisis, the Pan American Health Organization has established a high-level commission on mental health and COVID-19 to provide critical and urgent guidance to the organization and its member states, not only to reinforce national and regional mental health responses to support COVID-19 pandemic recovery, but importantly, also to ensure that we all support the building of more resilient and equitable mental health programs and services within the overall transformation of the health system and the sustainable development agenda. We are indeed privileged to have such a diverse group of commissioners who will provide a comprehensive view of the challenges that we face in mental health. And thanks again for your commitment, commissioners. The commission includes experts from across the region, leaders in government, policy, mental health, academia, and civil society. Importantly, we also have gender diversity and persons with experience of mental ill health. They have the critical task of providing guidance on the necessary changes that will lead to sustained improvements in mental health throughout the region. I need to tell you that they have a full agenda to reach out to a broad range of regional stakeholders to develop their strategic evidence-based recommendations that can inform countries' policies and strategies in mental health during and certainly after the COVID-19 pandemic. Their recommendations will also critically inform PAHO's technical cooperation with member states on mental health. We have great expectations that the work of the Commission will lead to the elevation of mental health to the highest level of government, providing a catalyst for meaningful and long-lasting reform to mental health services and care. So I'm also hopeful that this initiative will inspire the formation of fruitful whole of government and whole of society partnerships and collaborations to advance mental health in our region. I invite all of you to join us and contribute as we embark on this journey to build back better mental health in the Americas. Thank you so very much. Over.
Thank you, Dr. Etienne. The establishment of the Commission would not have been possible without your leadership and support. And now it's my pleasure to introduce Her Excellency, Ms. Epsi Campbell-Barr, Vice President of Costa Rica and Chair of the Commission. Madam Vice President, the floor is yours.
Good morning.
Mrs. Carissa Etienne, I'm so glad to be here and to advance in this issue of mental health. Señor Néstor Méndez, Secretario.
Mr. Néstor Méndez, Assistant Secretary General of the Organization of American States, members of the High-Level Commission on Mental Health. I really would first like to congratulate Dr. Etienne for the perfect solution of creating this commission. This is a debate we have been talking about and working on jointly, and Dr. Etienne's commitment has been absolutely decisive so that we today can set up this commission on mental health within the context of COVID-19. The pandemic, as we know, as has been shown, not only has affected the physical health of people, it has also seriously affected the mental health and welfare of millions of persons, particularly women, youth, and the groups that were already vulnerable. The confinement, the closure of schools, telework, the care of the different members of the family has led to additional pressure for women. And they have now even more felt the enormous responsibility and has made the crisis of caregiving even worse. But the loss of employment has also particularly affected women. The violent expulsion for months of children and adolescents from the educational system as a result of the lockdown placed us in a very serious and vulnerable situation. Today, more than ever, we see the anxiety amongst the youth, the men and women who already have sustainably attempted suicide, anxiety, depression, all related to this occult pandemic that we already had before the COVID-19 pandemic, which is mental health. The United Nations organization itself mentioned that the COVID-19 pandemic is clearly showing us the need to increase investments in mental health services urgently. And the world needs to do more, and not just more investment, but change the focus on how we see mental health problems, not just from the point of view of mental diseases or chronic mental health. Mental health must be seen comprehensively. Promotion, prevention, dealing with the perspectives of the different agents, as we've seen in the establishment of this commission, with experts from the health system, people related to academia, persons involved in social organizations, and later on we're going to have also the viewpoints of the private sector, which implies that if we consider the question of recovery and inclusion, social inclusion, economic inclusion, we will definitely have to be dealing with mental health issues. From the moment when we read the policy document on COVID-19 of the United Nations, it was mentioned that the need for mental health should be considered. This pandemic made us reiteratedly hear of topics that we seldom gave any importance to in the past. We know that investment in mental health is one which not only generates welfare, it decreases the investment in all the efforts made to ensure people's physical health because of the direct correlation that there is between these two. Today, it's more necessary than ever to call on everyone to deal with the question of mental health. And once again, PAHO is taking that step forward as a region and is taking that step forward as a much more comprehensive approach of health, where not only should we take steps of an immediate nature, but questions of prevention that can help respond to the impacts of violence within the context of COVID, and particularly to have more sophisticated services and care to matters related to domestic violence and intra-family violence, and essential issues like the recovery of the victims and survivors of violence. For some months, we have been strengthening the Alliance of Mental Health for Women, which seeks to establish dialogue and exchange experiences and find initiatives nationally and regionally that can have a direct impact on the mental health of millions of persons. This space should allow us to promote a political declaration and a political agreement, a pact, something between the states and the society as a whole, so that we can take on concrete actions considering the needs of women, children, youths, Afro-descendants, indigenous, in lieu of the impact of COVID-19 and its effect on mental health. We have to recognize its importance. We have to prioritize mental health and the welfare of people, but in particular, those who have urgent needs like women during and after the pandemic. Now, we're in what we could call the post-pandemic era, and we're just entering that. We're trying to see how those doors can be opened, but it's imperative that public health be related directly to the human rights and include a holistic vision of mental health. And version that would help us understand the impact of all effects of discrimination on mental health. For example, the Afro-descendant people, the indigenous people who have an even greater weight due to racism, and the specific impact on mental health post-pandemic. Of course, it's clear that the states must promote policies, plans, and projects geared to promote and care for mental health at all levels. We're considering the educational system, the productive system, and not just see it only from the viewpoint of health institutions. It must have a gender approach, a human rights focus, diversity, total inclusion, with the promotion of recognition and understanding of the impact of the inequalities in general, but in particular the racial inequalities and gender inequalities in the establishment of mental health for women and the people who have structural discriminations, to promote in regional, national initiatives, recognizing the importance, talking about these, opening fora, involving the media, generating all these strategic partnerships that can help. And that's why PAHO, led by Dr. Etienne, has taken this timely decision of starting this on this road. And now more than ever, we have to think of the new society we want to build. The pandemic must serve as a tool, not only to see the negative impacts, but to take a qualitative step forward for the welfare of people. The emotional welfare, physical, economic, cultural welfare, and social. That welfare that means that we understand that mental health is a central axis that can ensure human rights to all, particularly women. Welcome to all of you to this commission. The work ahead of us will be difficult, but will be highly satisfying. And I know of the commitment not only of PAHO, but of each and every one of the members of this commission for the welfare of mental health in this hemisphere. Thank you so much.
We are grateful to have Her Excellency, a strong advocate for health equity in our region, leading the Commission. And we again thank her for her contributions. Next, we will hear from her co-chair, His Excellency, Ambassador Nestor Mendes, Assistant Secretary General for the Organization of American States. Mr. Ambassador, you have the floor.
Thank you very much, and good morning to everyone. Her Excellency Epsi Campbell Barr, Vice President of the Republic of Costa Rica and Chair of the Commission, Dr. Carissa Etienne, Director of the Pan American Health Organization, the Honorable Terrence Singh, Minister of Health of Trinidad and Tobago, Honorable Lida Mercedes Sosa Arguello, Vice Minister of Governance and Health Monitoring of Paraguay, Dr. Jarbas Barbosa, Assistant Director of PAHO, distinguished commissioners, ladies and gentlemen. We have often cited during the past 2 years the impact of the COVID-19 pandemic on the lives and economic well-being of people in our region. In a region where we have seen a death toll of over 2,200,000 people, which represents about 46% of deaths globally. This has understandably been the significant focus of attention. The untimely arrival of the pandemic and its prolonged effects have had comprehensive impacts on the people of our region, particularly in the lives of those who are in vulnerable situations. This global emergency revealed long-standing structural challenges that have always been present in our societies: inequity, violence and gender violence, exclusion, discrimination, and gaps in access to rights for many citizens of the Americas. One of these structural challenges that perhaps has not been so visible, but certainly palpable, is the growing toll that the pandemic has taken and continues to take on mental health in the Americas. From early in the pandemic, we began hearing and reading about the stress and anxiety caused by the uncertainty in the progression of the pandemic, the loss of loved ones, having to learn to deal with isolation and a new way of life. As collective experiences with the rippling effects of COVID-19 were broadcast in real time, we witnessed the anguish of health workers as they struggle to cope in the most unfathomable of demands and circumstances. And as the pandemic drew on, families had to adapt to situations of economic upheaval in some cases, in others to new dynamics of working and living as mobility restrictions, physical distancing, telework, and virtual learning became the norm. In early 2021, there were still approximately 114 million children and youth in the Americas that had not returned to in-person schooling and would not do so until a year later. We have learned of the effects that this ongoing situation has had on women who have had to leave the workforce and those who have been victim to the surge in gender-based violence. According to the WHO, it is estimated that the COVID-19 pandemic led to a 27.6% increase in cases of major depressive disorders and a 25.6% increase in cases of anxiety disorders worldwide in 2020. Furthermore, the greatest increases were found in places highly affected by COVID-19, as well as low and middle income countries. Most of the countries in our region are low and middle income countries. Considering the high incidence of COVID cases and death in our region, as well as pre-existing inequalities, the work of this PAHO High-Level Commission on Mental Health and COVID-19 is timely, relevant, and indeed urgent. Addressing the connection between mental health and COVID-19 in this high-level commission is a necessary step towards deepening discussions and solutions aimed at improving mental health in the Americas. From the OAS standpoint, we welcome this as an opportunity to broaden dialogue and set forth a multi-sectoral path for action. The Inter-American system recognizes health as a fundamental human right, and in this regard, universal access to mental health is intrinsic to the general advancement and well-being of our communities. Therefore, a comprehensive COVID-19 recovery plan must include prioritizing mental health with a human rights perspective and taking into account the particular situation of women. Prior to the COVID-19 outbreak, many countries in our region were already struggling to meet mental health demands arising because of historical under-resourcing of mental health care systems. And although the Declaration of Caracas represented a paradigm shift to a preventive and human rights focus on dealing with mental health, in many countries of the Americas, where mental health care models have not evolved, the scarce resources available are still often allocated to psychiatric hospitals. Access to care and treatment availability remains very limited. In 2018, studies showed that the median treatment gap for various mental health conditions in the Americas was approximately 71%, increasing to over 80% for different countries. And when analyzing specific groups, such as, for example, indigenous populations. So the reality prior to the pandemic was that the mental health situation was very precarious. As the pandemic brought about aggravated effects on mental health, there were disruptions in existing mental health services, particularly affecting outpatient treatments and certain groups in vulnerable situations, including, among others, children, adolescents, and people with continuing substance use disorders. With closure of schools and access to in-person facilities, we will likely learn that the treatment gap has widened during the pandemic. And today, 2 years and some months after the first COVID-19 cases hit the Americas, we know that we are still at a distance from understanding the full impact that the pandemic will have on mental health. But we are also aware of the financial burdens and other healthcare demands that have required immediate attention from governments, such as vaccine availability and medical facility infrastructure. It is therefore a necessary task to also bring forward the issue of mental health in all its complexity and as a priority. I mention the complexity because I understand that this effort presents certain challenges of its own. We know, for example, that there is still a great stigma connected to mental health in the region, and that requires appropriate attention. Rooted in societal norms, reduced access to education about mental health cause a lack of understanding, resulting in stigmatization of mental health conditions in many areas of our region. This stigmatization constitutes not only an obstacle in the construction of public policy, but it also adversely affects the generation of appropriate conditions for access to mental health services. The challenge that stigmatization poses is amplified when considering the differentiated impact of the pandemic in general for persons in vulnerable situations and those affected by discrimination. Persons with disabilities, older persons and individuals with pre-existing medical conditions, women, children and adolescents, LGBTI persons, and disenfranchised communities face greater risks to suffering from mental health in the current setting. And yet, these are the people who are most likely to lack access to human rights such as health, and who we need to think about when ensuring that universal mental health care becomes a reality. It is therefore very relevant that we consider in addressing the various aspects that will be set forth to this commission, that this is an opportunity to bring forth a cultural change with respect to mental health in our region and with special attention to women. This cultural shift can lead us away from stigmatization and towards more inclusive and open conversations to educate and generate a collective commitment to building back better mental health systems. I especially wish to thank Dr. Carissa Etienne for promoting this initiative and bestowing upon me, and really the OS, the honor and responsibility of serving as co-chair together with Her Excellency Epsi Campbell Barr, a distinguished leader and a voice for the rights of all people in the Americas. I reiterate both my personal commitment and that of the OS to the work that we are undertaking. It is time to think outside of the box, and together we can and must look for those solutions. I trust that the conversations and work that we initiate today will be fruitful. The exemplary group of experts that have all accepted this call to action is a promising first step, and I am certain that the results will be of immeasurable value to our region and our communities. Thank you. Muchas gracias.
Thank you very much, Ambassador Mendes. Your long-standing commitment to equity and development in the Americas through multi-sectoral partnerships is a great asset to the Commission. Understanding the diverse mental health needs and responses of different countries in the region will be crucial to the work of the Commission. We will now hear from the Honorable Dr. Lida Mercedes Sosa Arguello, Vice Minister of Governance and Health Surveillance of Paraguay, on Paraguay's experience of working on mental health during the pandemic.
Muy buenos días.
Good morning. Thank you very much for the opportunity to share this space with all of you. Thank you very much to Dr. Carissa Etienne. My greetings also to Mrs. Evie Campbell-Stars and Ambassador Nestor Mendes, who spoke before me, and to all the other speakers who are here with us today. For us, the possibility to share Paraguay's experience in promotion and protection of mental health of youth during and after the pandemic is a great opportunity to showcase our reality with the gaps and limitations we have in the area of mental health. For us, this is a great opportunity to reflect on this situation that is common to the reality of many countries, especially in our region. I will share my presentation on the screen so you can follow my words. From the beginning of the pandemic, the Health Ministry of Paraguay has tried to make visible all that has to do with mental health and give it the importance and relevance that this area should have. We have worked in providing information about promotion, prevention, detection, and addressing mental health situations in our population. And within the special initiative, mental health initiative of WHO and PAHO, the Mental Health Directorate of our ministry has been coordinating since 2020 the Technical Commission for Mental Health in Paraguay. And this commission has made strides in the regulatory area, in the area of legislation. And we expect to have specific laws very quickly. And the initial special initiative of WHO for mental health that looks to ensure universal health coverage, implying quality access in 12 priority countries. This has also been very relevant for us because this will promote mental health policies, human rights defense, and expanding interventions and quality services for individuals with mental health problems and other similar problems. This is an important roadmap for us because WHO is the guiding organization in this area. We have implemented guidelines and protocols in the framework of the pandemic with psychosocial and mental health recommendations in the COVID-19 context for the general population, for adolescents, and guidelines for telephone assistance and psychosocial support and mental health during COVID-19. And we have seen limitations during the pandemic, and then we have opened up hotlines to give rapid response to different mental health situations. And these have been very impactful to assist the population that needed to go to our facilities and health facilities. And through these telephone hotlines, we have been able to give response. We have also established protocols about mental health guidelines in shelters. We have different shelters for pregnant women, for maternal health, and we also have long-term care facilities and also midway homes for people who have been released from psychiatric hospitals. And we have a collaboration in mental health of the protocol of safe return to educational institutions in pandemic. This has been a very participatory process, and it has been approved by the Ministry of Education of Paraguay. As I said, all of these materials were developed in a highly participatory way involving scientific associations to have their endorsement. We have also used social media and implemented communication plans to reach the general population, promoting healthy habits And also we have implemented trainings for different health professionals at the different levels of healthcare. We in our network, our service red network has different care levels, going from a primary care strategy to the highest hospital, specialized hospital. We have implemented different trainings for different professional groups and occupational groups to implement different visions and different conduct vis-a-vis the general population. And these trainings were given on a life cycle, with a life cycle focus. Next, please. We have conducted institutional and intersectoral efforts for different mental health trainings with the Education Ministry, the Justice Ministry, and the Women's Ministry. And thereby we have trained more than 1,500 individuals, not only health professionals, but also other individuals that had contact with the general population in the area of care for users. We have adapted safety measures in mental health care to ensure the continuity in service, a gradual implementation of telehealth services during the pandemic to expand our reach. This has to be implemented for what I already mentioned, that many of our outpatient services had been forced to cancel their in-person provision because we had losses of human resources and the loss of specialized professionals in mental health. This is another of our limitations. We have integrated all over the pandemic 85 new professionals specialized in mental health. As I already said, having specialized professionals in this area for us is a limitation. We have a significant demand and our gap is really huge because we do not have this type of professionals, and we are aiming at implementing a higher training of professionals both in psychiatry and in psychology to respond, to meet this demand. But we have been unable to implement fully this so far. So we are implementing training for human talent with a focus in quality care in the area of mental health with different levels of care in different specialties and disciplines in the huge area of health and mental health. And we have also increased our mental health directorate. We have 18 health regions in our 18 departments in the country. We have expanded the mental health directorate within the public health ministry, focusing on these region health regions. And we have a link for the general population to access this directorate and directory so that the population knows where to call when they need specialized care. These are strides in the pandemic when it comes to mental health care. We know that we have an outstanding task because, I repeat, we have huge gaps. And the pandemic has revealed even more our weaknesses. And we are working on a plan to be able to respond to these needs. And this commission will help us to have a clearer roadmap to follow. Thank you very much.
Thank you, Dr. Sosa Arguello. We appreciate your insight into Paraguay's experience. Next, I would like to welcome the Honorable Dr. Terrence Singh, Minister of Health of Trinidad and Tobago, to present on the perspectives of Trinidad and Tobago. Dr. Singh, the floor is yours.
Hola, buenos dias. Your Excellency, Ms. Epsi Campbell-Barr, Vice President of the Republic of Costa Rica and Chair of the Commission, thank you for your advocacy and commitment to the cause. Dr. Carissa Etienne, Director PAHO, thank you for your vision in setting up this commission. Mr. Ambassador Nestor Mendez, Assistant General Secretary, Organization of American States and co-chair of this commission, thank you for accepting the challenge. The Honorable Dr. Lydia Mercedes Sosa Aguilo, Vice Minister of Governance and Health Surveillance, Paraguay. As a colleague health minister, I empathize and sympathize with you and thank you for your leadership in Paraguay during this COVID-19 pandemic. Representatives of the Pan American Health Organization, participants. It is an absolute pleasure and honor for me, representing Trinidad and Tobago, to be invited to speak before this commission. Next slide, please. Yes. When the SARS-CoV-2 virus began its spread over 2 years ago, the government of the Republic of Trinidad and Tobago rightly anticipated that creative, resourceful approaches would be required. On March 12, 2019, just 1 day after the coronavirus disease was declared a pandemic by WHO, we operationalized a parallel healthcare system for the holistic care and treatment of persons who would be infected by the then threatened virus, thus preserving our traditional healthcare system. This meant that other services, including mental health services, could, with the appropriate infection prevention safeguards, continue to be provided to our population. During the very earliest days of the COVID-19 pandemic, as Minister of Health, I recognized that a robust mental health response would be required. The Trinidad and Tobago Ministry of Health, therefore, quickly began to put systems in place to ensure that as soon as a parallel healthcare system was operationalized, mental health support would be an integral part of that system and would be easily available to persons who tested positive for COVID-19 virus, persons in isolation, quarantine, or hospital, and frontline workers. We must not forget them. Simultaneously, the Mental Health Unit of the Ministry of Health began a program of public messaging aimed at assisting persons in coping with the challenges of the pandemic, while a number of local professional organizations, non-governmental organizations, and other mental health stakeholders began to adapt and expand their services to assist persons with their psychosocial needs. Next slide, please. The Ministry of Health quickly took note of these stakeholders' efforts and recognized the need to partner with provider organizations. We also took note that such partnerships are endorsed by the World Health Organization and the Interagency Standing Committee as the best approach to providing mental health and psychosocial support to populations. With technical assistance from PAHO, and I congratulate and thank PAHO, this led to the establishment of a mental health and psychosocial support technical working group on May 5th, 2020, 2 years ago. Next slide. This working group has since created a digital directory of crisis and emergency health services under the rubric of findcare.com. This was followed by the publication of a print version of the information provided on the website, and that booklet is currently being distributed. Here you can see some pictures of the website as well as a printed hard copy. But there are challenges. As we begin to transition away from the emergency response phase of the COVID-19 pandemic, the government of Trinidad and Tobago is mindful of the significant, frequently reported mental health impact of this pandemic on populations, including our own. At the same time, we are mindful that our economy, and this is a common theme I am hearing throughout other presentations, and the effect on women and children, like many world economies, has been impacted by the demands of the pandemic. Many individuals were unable to work, and this is a common theme from all presentations again, during the stay-at-home measures. These were put in place, and this government has expended significant financial resources on social support, as well as COVID-related pharmaceutical and non-pharmaceutical goods and services. Next slide. In July 2019, the Cabinet of the Government of Trinidad and Tobago, this is prior to COVID, approved the country's first national mental health policy, with implementation scheduled to span the period 2019 to 2029. This policy focuses heavily, and I am hoping at this time, the same way I am learning from the experiences of Colombia, Paraguay, and I thank you for those learnings. I am hoping that we could share some of our experiences, and maybe you can consider whether it can be used in your own countries as we cross-pollinate ideas this morning. This policy focuses heavily on the decentralization of our mental health, away from a dependence on long-term institutionalization to a more community-based point-of-care treatment and monitoring where clinically appropriate. And that is key, where clinically appropriate. Cabinet, in approving this policy, clearly stated inter alia that emphasis would be placed on the prevention of mental disorders through the promotion of a culture of self-care, resilience, and most importantly, mutual support. Our path forward therefore hinges upon fiscal reprioritization to support this reorganization of healthcare, and where needed, the expansion of mental health services with a healthy focus and a heavy focus on health promotion and disease prevention. In this regard, Trinidad and Tobago embarked upon several bold initiatives, and I want to thank Ambassador Mendez here, because he spoke about a recovery plan and outside the box thinking. Thank you very much for that. And this is where we can come together and share ideas. On March 27th, 2020, mental health workers from all 5 of our regional health authorities were trained in the provision of tele-mental health services and standard operating procedures for the delivery of these services. This has added to our mental health arsenal as a valuable tool that, together with our MHPSS stakeholders and the FindCareTT.com website, equips us for the medium to long-term mental health fallout of the pandemic. Next slide. We are currently engaged in the integration of mental health into primary care as part of our decentralization. And in that regard, training of our workforce began in 2013 with the launch of MHGAP. Many of our primary healthcare workers received training in mental health using MHGAP curriculum between 2015 and 2018. And we are now preparing to expand this using the train the trainers approach. A training program for the prevention and management of aggression and violence, which has been exacerbated by COVID-19, is also currently being rolled out to mental health workers, primary healthcare workers, and several other stakeholders, including our municipal police force. The Ministry of Health, next slide, is collaborating with the Ministry of Education to formalize a school-based mental health program to meet the needs of students, teachers, parents, and other valued stakeholders. This mental health literacy program will be executed through technical assistance from PAHO, thanks again, and aims to bridge the gap between the education and mental health systems. The number of hospital beds available in general hospitals for persons who need inpatient care are being expanded. We will be seeking to, with the next slide, to produce specialized healthcare at our major hospitals as part of this decentralization project. And this is where we plan to produce about an 89% increase in the total number of dedicated hospital beds in a general hospital setting, away from the previous institutionalized long-term setting where patients were kept there for as long as 23 and 30 years. Next slide. Mental health promotion activities now include sensitization about findcareTT.com, which has been an absolute success story, as the data will show you there. I will not go into the details. In addition, the site is now frequently shared on many social media platforms, and sensitization is ongoing. With a small population of 1.4 million, there are about 64,000 page views, 15,000 new users in the past month. And the prevention of mental health disorders through promotion of a culture, again, of self-care, resilience, and mutual support. As I come to an end, finally, I frequently remind team leaders of the ministry, you cannot manage what you cannot measure. Data is important. We are therefore in the process of operationalizing a mental health information system, as well as a suicide surveillance system. Excellencies, doctors, healthcare workers, policy experts. The COVID-19 pandemic has been fraught with individual and institutional stressors. The Trinidad and Tobago National Mental Health Policy provided us with a foundation on which to build a stronger, more resilient mental health service. And we are fully committed to fulfilling that mandate. In closing again, may I congratulate Dr. Carissa Etienne for her vision, congratulate Your Excellency, Ms. Epsi Campbell-Barr, for your commitment, your advocacy, Ambassador Mendez for your co-leadership, my colleague from Paraguay for sharing your vision, for sharing your challenges. And I'm hoping that this cross-fertilization of ideas and themes will help us all as a Pan-American region emerge from this acute post-COVID phase in a better position to deal with the mental health sequelae that will be with us for years. I thank you and look forward to the rest of the discussions.
Thank you, Dr. Dayal Singh, for sharing with us the Trinidad and Tobago's experience of advancing mental health during the pandemic. I'll now give the word to Dr. Ansam Hennis, Director of the PAHO Department of Non-Communicable Diseases and Mental Health, who will provide us with an overview of mental health in the Americas and the High-Level Commission on Mental Health and COVID-19. Dr. Hennis, the floor is yours.
Thank you, Dr. Renato. Excellencies, the chairs of this commission, honorable ministers who have presented this morning, distinguished commissioners, Madam Director of the Pan American Health Organization, Assistant Director Jarvis Barbosa, colleagues of PAHO, distinguished ladies and gentlemen, it's a pleasure to be here. Good morning. So my brief is to take you through an overview of the work of the Commission and the rationale for the Commission. As you can see from the very first slide, of mental, neurological, and substance use disorders and suicide account for more than a third of the total years lived with disability in the region, as well as a fifth of total disability adjusted life years. There are tremendous challenges with treatment gaps for mental health, as you would have heard earlier, and nearly 90% of people in the Americas do not receive the treatment they need, particularly for acute psychosis. We can go to the next slide. Suicide continues to be a major challenge in this region. There are nearly 95,000 deaths by suicide annually. And in fact, 2 countries of our region are listed among the 10 countries with the highest suicide rates globally. Regrettably, we're seeing an uptick in the rates of suicide, which have actually been increasing by 17% since 2000. Next slide. As you've heard, there are challenges with financing. Health budgets in the region of the Americas are generally below the recommended 6% of total gross domestic product. And in fact, in the Americas, the median financing of mental health is only 3% of the total health budget. And furthermore, approximately 50% of these funds are directed to psychiatric hospitals. There's an ongoing lack of investment in human resources for health. And as you've heard also, there are challenges with inpatient hospitalizations. And nearly 30% of all mental health stays in the region of the Americas exceeds 5 years. Next slide. You've heard much about the impacts of the pandemic. You've heard about the risk factors for poor mental health, unemployment, finance and security, etc., grief and loss. You've heard about the consequences of the pandemic, high rates of depression and anxiety in the populations. And we also know that particular groups are at higher risk of worse mental health outcomes, particularly health and frontline workers, women, we've heard much about it this morning, children and adolescents, ethnic and racial minorities, as so eloquently expressed by Her Excellency Vice President Epsie Campbell, and people with pre-existing mental health conditions are also among those who are vulnerable. Next slide. We have known that a consequence of the pandemic has been disruptions to mental health services, and this you can see outlined here, and this has continued to be evident in the other pulse surveys to assess disruptions to health services. Let's go to the next slide. So why are we developing and establishing a mental health commission and mental health in COVID-19? Clearly, in light of the mental health situation created by the COVID pandemic and the pre-existing situations that were so well discussed this morning, it becomes necessary to chart a way forward for the entire region. So the mandate of the Commission is to raise awareness of the critical importance of mental health in the region of the Americas and to provide guidance to the Pan-American Health Organization and its member states on strengthening mental health systems and services during and after the pandemic. Next slide. We are very, very grateful to our leadership of the Commission, Her Excellency Epsie Campbell-Barr, Vice President of Costa Rica, and the co-chair, Assistant Secretary General Nestor Mundez of the Organization of American States. Let's go to the next slide. I'm going to go very briefly because we have many distinguished commissions, but I'm going to name them: Dr. Khadija Khan, Dr. Shekhar Saxena, Ms. Paulina Del Rio, Ms. Sahar Vasquez, Dr. Paul Bolton, Ms. Ana Cristina Mendoza, Dr. Paulo Rossi Menezes, Dr. Pamela Collins, next slide, Dr. Maria Elena Medina Mora, Dr. Shirley Holloway, Dr. Juan Pablo Uribe, Dr. Mary Bartram, Dr. Carmen Monton Jimenez, Dr. Ruben Alvarado Munoz, and Executive Secretary Alejandra Mora Mora. Time does not permit me to go into a detailed discussion of their achievements, but we will make this information available to all on our site so you can come to familiarize yourself with the breadth of experience and knowledge and expertise of our commissioners, each one distinguished in his or her own right. So what will the commission do? The remit that we have established, which they will discuss and they will modify as necessary, is that they will meet virtually on at least 3 occasions this year. They will discuss priority issues in mental health with support from key stakeholders. They will develop a final report with recommendations, which we hope to publish by the end of this year. Next slide. And these are some of the suggested key topics that the Commission might discuss: financing for mental health equity, human rights for mental health as a key component of universal health coverage, mental health promotion and prevention, mental health and psychosocial support in emergencies. And these are suggestions, but the Commission will have the mandate in the brief to take this discussion where it sees most fit and most appropriate. Next slide. How can I get involved? How can you get involved? How can we all get involved? There will be a virtual platform for the Commission, which will be in 2 languages at present, and it will be available at mhc.paho.org, where you can log in and learn more about the Commission and its work. You can send emails to the Commission, mhcommission@paho.org, and please look for opportunities on the platform and PAHO's social media to participate. This is a commission where each of us has a role to play. So get involved. Thank you. Over to you, Dr. Renato.
Thank you very much. It's clear that the COVID-19 pandemic has exacerbated an already critical mental health situation in our region, and that we need to act urgently and strategically. The High-Level Commission on Mental Health and COVID-19 will greatly support us in this. And to conclude today's event, I would like to invite Dr. Jarbas Barbosa, Assistant Director of PAHO, to give us his closing remarks.
Thank you, Renato, and thank you to all our colleagues and friends from across the region of the Americas who participate in today's launch of the PAHO High-Level Commission on Mental Health and COVID-19. We have had around 500 participants in this event. We are particularly grateful to the Honorable Lida Mercedes Souza Arguello, Vice Minister of Governance and Health Surveillance of Paraguay, and the Honorable Terrence de la Singh, Minister of Health of Trinidad and Tobago, who took the time to share the experiences and perspectives on the impact of COVID-19 on mental health in their national responses. It's very important to see, despite all the difficulties faced by the countries, how they tried and they got more resources and to have implemented some very important measures to respond to the mental health crisis that was also produced by the pandemic. I would also like to express my sincere gratitude to the members of the Commission for their commitment to assist the region as they undertake important new roles, and to Honorable Mrs. Epsi Campbell, the Vice President of Costa Rica, and Ambassador Nestor Mendes for their leadership on this endeavor. We all envision a region where everyone has access to comprehensive, equitable, and community-based mental health care, grounded in individual respect and human rights. While the region has come a long way, much more needs to be done to achieve this vision. The impact of the COVID-19 pandemic on population mental health and the simultaneous occurrence of disruptions in mental health services threaten to delay our achievement of the regional targets and goals in mental health. The pandemic, however, also presents us with a unique and critical opportunity to advance mental health in the Americas. We can benefit from lessons learned during the crisis to build back better mental health systems and services that are well-resourced, more resilient, and equity-oriented, leaving no one behind. We can adopt innovative approaches to strengthen and improve mental health in our region, approaches that ask for a whole-of-society collaboration and action to be taken at the highest level of national leadership. The PAHO Commission on Mental Health and COVID-19 will play an essential role in highlighting the way forward to the Americas as we navigate today's unprecedented challenges to our health systems and strive to build better mental health for our populations. I believe in its great potential to increase the visibility of mental health, to advocate for necessary transformation, and to inspire mental health initiatives across the region to benefit all. The report with the recommendation that this high-level commission will present will certainly be very useful to all members of the Pan American Health Organization. Together, with the support of the High-Level Commission on Mental Health and COVID-19, we can come closer to make our shared vision of optimal mental health for all our reality. Thank you.
Thank you, Dr. Jarbas, and thank you to everyone who joined us today for the launch of the High-Level Commission on Mental Health and COVID-19. We are excited to include you in this important initiative and look forward to seeing the Commission in action. Please remember to connect to the PAHO virtual platform for the Commission, available in both Spanish and English at mhc.paho.org, so you can learn more about the Commission and its work, and also to follow PAHO social media channels for opportunities to participate. Thank you very much again, and have a wonderful day and stay safe.